Hello, everyone. Welcome. We're going to get started in just a moment, but we're going to let everyone have some time to hop on first. Okay, we'll just wait another 30 seconds or so. Okay, we're going to go ahead and get started. Thank you, everyone, for being here today. I'm Mandy Sandcooler. I'm your Field Services and Communications Director, and we are joined today by a team from RecoveryPlus, one of our partner organizations. So we're really excited to be able to talk to you about remote cardiac rehab and all of the benefits it brings with it. Before we get started, I just want to remind you all that you are all on mute. But if you have questions throughout the presentation, please put those in the chat box and we'll answer those. There will also be time at the end for questions, so you can put those in the Q&A and we will answer those then. For right now, I would like to introduce our three speakers today. They are Tim Bilbrey. He's a president and CEO, or co-founder, pardon me, of RecoveryPlus. We've got Peter Niemi, who's the CEO and the other co-founder to RecoveryPlus. And then we've got Jenny Martin, who's the Chief Nursing Officer. So thank you all three for being here, and I'm going to let you take it from here.
Thank you so much, Mandy, and thank you everyone for joining. Again, my name is Peter Niemi, and shortly I'm going to turn it over to Jenny and Tim, who will talk to you about the details of our home-based cardiac rehabilitation program. Just by way of quick introduction, RecoveryPlus is the product of many people, Jenny, Tim, myself, among them, who really are on a mission to scale access to cardiac rehab. Cardiac rehab is known to work. It's very effective at doing a very important thing, which is lower hospital readmission rates for people with cardiac issues, and yet it is wildly underused in the United States. According to Medicare, there are roughly 1 million people who should be on cardiac rehab who are not, and that's actually a pretty conservative estimate. The number is probably closer to 5 or 6 million. And so the mission of RecoveryPlus is to try to close that gap. And one of the early observations that Jenny and Tim are really responsible for was the fact that to approach anything like the scale that we'd like to see for cardiac rehab, it needs to become home-based. There simply aren't enough in-person clinics. It's too difficult for people to travel regularly to get to clinics. And so this needs to be made more convenient so you can do it at home, you can do it at any time. And so that's what we've come up with. This is a home-based cardiac rehab program. We've been growing this venture over the course of the last few years. And then several months ago, we had the good fortune to meet Mr. Alvarez and Mandy and the team at the Mended Hearts. We had several conversations about how we could partner up to make this type of service available to the Mended Hearts members. So we are very happy to be here today speaking with all of you. I'm going to take you through the program. As Mandy said, if you have any questions, please feel free to type them into the chat box. Mandy and myself will be monitoring that during the course of this presentation, and we'll make sure any specific questions you have are addressed either during the presentation or at the end when we will leave some time to chat. That's really all from me. Really appreciate the opportunity. Thank you for joining today. Tim and Jenny are going to take you through our program. You are in supremely good hands. And so, Tim, Jenny, take it away.
Yeah. Thank you very much. Thank you again, everybody, for your time and allowing us to speak with you all this afternoon. And really just to talk and echo what Peter was saying. Again, the joint mission that we're here for is to expand the delivery of cardiac rehab, which is, as I said, it's a very important life-saving service. But unfortunately, it is sometimes very difficult and sometimes cumbersome to try to get into, which is why participation rates are so low of where they're at. So really, joint mission is to make cardiac patients aware that there is another option out there when they return home, and being able to perform and participate in cardiac rehab from their actual living room. So as Peter had mentioned, people who are eligible for cardiac rehab over the course of the last several years and about the last decade of doing an actual in-depth dive, Medicare's done an in-depth dive regarding cardiac rehab and the participation rates, and unfortunately, 80% of those people who are eligible for cardiac rehab do not or are unable to participate, usually because of the geographic location. There's just not a program located by you to be able to participate in. Sometimes there are co-pays, and it can add an increased expense to you. Time constraints. Typically, cardiac rehabs are offered Monday through Friday from 8 to 5. So if you're a working individual, that sometimes can be very difficult to go to, and then also to a lack of staff. Also, to building off of the facility location, most cardiac rehab centers are located actually in urban areas. And even to where I'm at currently right now in Texas, there's about a 500 square mile radius of where I am out in a rural area. And there are 2 cardiac rehab programs, and the nearest one to me is about an hour and 15 minutes away. So if it was myself or one of my family members, any sort of friends or anyone that in the community where I'm at right now, they would be unable to participate in cardiac rehab because they just don't have that option available to them. But fortunately for now, with RecoveryPlus and the partnership we have with Mended Hearts, like I said, we are able to provide home-based cardiac rehab to Mended Hearts members and other patients that are out there, hopefully that are listening into this conversation right now. There's an extra option for you, which again brings it back into the home. So again, looking at it, we all know cardiac rehab, saves lives, and so we're not going to go into and just tell you, how beneficial cardiac rehab is. Cardiac rehab has actually been around since the 1960s, and there's decades and decades of practices in patient cases that show that cardiac rehab does in fact save lives. But also to the federal government, Medicare, they've started looking at readmission rates of patients who actually have a sort of a heart attack or stent or bypass surgery. And it is a very unfortunate that, between 25 and 30% of patients who go in with a heart attack or go in and have heart surgery or go in and they have, heart failure and they need some of the fluid pulled off of them, that realistically, there's 25 to 30% of people who actually go into the hospital will return to the hospital within the next 30 days due to some form of inadequate undertaking or some reason that brought the patient back in. And from our perspective, a lot of times what we see is usually it's something very simple. Usually it's something like a medication. Maybe a medication was not filled, or maybe it was not prescribed, or maybe, medications weren't taking right. But then again, that's kind of where a program like ours comes in, is for one, you don't have to wait. If you've already participated in cardiac rehab, you can still participate in this program. We are classified, differently. And so if you've already, participated in cardiac rehab before, you can actually still participate in this program. And you don't have to wait for a heart attack. You don't have to wait to get readmitted. You can actually start, if you're out there, and you're listening to this program, you can actually start this program today to get, and we'll explain the components of it here shortly. But, this is a program that's available to everyone on this call at no out-of-pocket expense. Like I said, we're state licensed. We have all of our Medicare and commercial insurance credentialing and everything's in place. And so we take what the insurance pays us and we leave it at that. So, this would be a zero out-of-pocket expense for everyone that's out there listening to this right now. So really, when you look at what is the problem statement on and with cardiac rehab, is really also too, it is being underutilized. It's, another big reason of that, according to Medscape, which is not us, it's a third party. We're just taking the research and study that they've done, is that the big problem is that clinicians are not referring patients to cardiac rehab. During our time, pre-RecoveryPlus, worked for a very, very large healthcare system in the state of Texas. As a matter of fact, it was the largest healthcare system in the state of Texas, and they had this very in-depth, very comprehensive advanced heart failure program. And when we started talking to the patient, to the administrators and the physicians, I'm like, why are patients, in your programs? Every one of your patients are eligible for cardiac rehab. Can't we encourage them to be able to come to avoid, going into the hospital and going in and being admitted, because this is all preventable? And, unfortunately, the answer that was given was, well, the patients really don't, get on our radar until they're admitted. And so that's unfortunately, that's kind of really where the healthcare system fails is, we have to wait for something. We have to wait before, when you get admitted, then, people start really taking notice. And so, looking at it, with that being the case, it's the current infrastructure is not supporting patients to be able to be proactive, but also too, on the back end is, as few as, again, 14 to 35% of heart attack survivors and about 31% of bypass graft patients utilize these types of programs. Unfortunately, if you're in the area similar to where I'm at, anyone that's had a bypass or a heart attack, they go to the city, they have their procedure performed, and they come home. There's no traditional facility. There's no outpatient services for them to be able to participate in cardiac rehab, unless they join our program, and we can do it from the home. So then a lot of times too, primary care physicians, the current infrastructure where, where the patients are located, these rural health clinics, the cardiology groups, a lot of times physicians are just unaware of cardiac rehab programs that are in their area, especially when, what I like to say is, hopefully this is, post-COVID, a lot of facilities have closed down, and some are trying to reopen. But a lot of facilities actually, unfortunately, had to close down when COVID hit due to social distancing issues. And so, that is something that the emphasis of cardiac rehab is typically missed or referring patients to an actual program sometimes can become difficult. So really looking at us from RecoveryPlus perspective, the solution, we've made this, we've done everything we can to make this easy. Access and time, patients who are available. This is home-based, it's self-pay, so it eliminates the drive time expense. All of our services are covered by insurance. Any sort of low referral rates, we actually have the ability to screen people who are interested in the program. We will inform their physicians, their cardiologists, their primary care physicians. We'll inform them of your participation, but we can actually perform a, kind of like how we're doing right now, we can do a video appointment with you, and then we can refer you into the program to meet, when you meet the criteria. And one of the big pieces that we like to, sit back and smile on is, again, 25 to 30% of patients in the traditional healthcare system get readmitted at 30 days. And our current 30-day readmission rate over the last 5 years has been 2.1%. So really, when you look at what we do, we do have what we call 5 pillars of care. So in our program, we'll provide you with equipment, heart rate monitor, pulse oximeter, blood pressure cuff, weigh scale. If you don't have diabetic supplies, we'll provide those to you. because we want the data. We want to be able to track and trend you, see how you're doing, seeing how you're doing at home. So we track your vital signs, we track your symptoms. We understand and see what medications you're taking, and make sure you understand what it help with the education, make sure you understand what you're taking, why you're taking it, why is it important. Exercise, you will have the ability to be able to participate in exercise at home on your own through our app. Also, too, you have the ability, if you choose, another option is we'll obviously assign you an exercise physiologist personally, and you can even have kind of Zoom video appointments with them as well. So you can do in person just like this, or you can do exercises through the app, and then also too, nutrition, our dietitians are there for you, and we can create appointments so that you can be able to meet with a dietitian and go over any sort of dietary needs or anything that you might need at home regarding your nutrition.
Perfect. And now I would like to introduce everyone Miss Lenora. And Lenora, I'm going to let you speak here.
Hello, everyone. This is really exciting to me, mainly because some of the things that Tim just discussed, I was not aware of. Or was that Peter? Which one was talking? I did
Tim.
not. Okay, so I was correct. Okay. Yeah, I didn't know that this program had been around as long. And when I had a heart attack the first time, and I do say the first time, they offered me rehab. However, the time didn't fit anything. I couldn't work, I couldn't do anything. And they assigned me what time to come. I couldn't even select the time. So that made it really difficult for me to participate. And so 1 year later, I retired from my job. And within 6 months of that, I was back in the hospital again. I was tired. I was depressed. I was stressed. And the cardiologist recommended that I participate in the rehab program. And at that time, this was pre-pandemic, they actually came to the house. I thought that was wonderful. And then, of course, once the pandemic came, we started doing it through Zoom meetings like this one. And that was even better. And I've been doing this now every week. I have the energy to keep up with the child that you see here on the screen, my first granddaughter. I was actually able to go to the Dallas Fair with everyone because I had the energy and the stamina to do it. And I have not been to the hospital because I've had a heart attack again, and I feel great. So all those aspects that he mentioned, that means there's no reason for me not to do the rehab. I have every reason in my life to do it so that I can live a better life and be among the people that I love. So I can't think of any other reason. I mean, especially if your insurance or Medicare is paying for it. So all you have to do is devote your time, and then you'll realize in a couple of weeks, especially, that that's really all you're giving up, and you're gaining everything. You're gaining everything just by giving up 45 minutes. Sometimes a day. I'll be truthful, only exercise about 3 times a week. It's not something that I actually look forward to unless my granddaughter's there. She makes everything fun. So I started exercising with her. But now I actually have the energy to do that. But I have been very, very pleased, especially even with the dietetic information, because I'm diabetic also. And so I have to try to keep my weight down. and I don't have to drive anywhere. I don't have to worry about the whole house being clean. They're only going to see the part where you're sitting, and they don't really care anyway. They care about your heart. So, I'm really excited about the program. So to me, as long as they're around, I'll be around with them.
Awesome. Thank you so much, Lenore, for sharing. Okay, so I'm Jenny. I'm the CNO and nurse practitioner for RecoveryPlus. So I'm going to take you a little bit through kind of the process of what we do for each patient. When we do get a patient for the first time, we do an evaluation. They meet with myself or one of the other nurse practitioners. We do ask about pain screening. We ask about falls. We go over medications and provide any education. We also make sure that the patients have the medication that they need. And then from there, we decide what level of exercise to do. We send them to an exercise physiologist who would then do their testing, which is balance, strength, and step. We do exercise, we create reports. These reports actually do go to the physicians that referred each patient in, or sometimes, even if it wasn't the physician that referred you in, but maybe you have a doctor's appointment coming up, we would send a report to them as well. We reevaluate about every 3 to 6 months, and then we continue that reevaluation process. The exercise physiologists actually do reevaluations about every 30 days as well, and they'll add on different exercises or take off or modify as needed. We do a reevaluation, they recreate their therapy phase, and we just keep repeating this process again and again so that the exercise and the program is different for the patient. Part of that intake testing is a 6-minute walk test. This is kind of a staple of the cardiac rehab programs around the world. We also look at SF-12s, which is a quality of life questionnaire, the PHQ-9, which looks at anxiety and depression. We can use a hospital anxiety and depression scale depending on how recent their hospitalization was. And then we, of course, do a fall risk assessment. For the 6-minute walk test, it is a very simple walking test where they set up a path, they walk, and the exercise physiologist measures how many meters they walk in 6 minutes. When we look at each patient, we determine whether or not they need moderate intervention or high intervention. And how we do that is based on low risk, moderate risk, chronic condition versus high risk. So I'll tell you a little bit about each of those types here. A low risk level is a person that might have high blood pressure and diabetes. They live generally a pretty healthy lifestyle. They don't have much family history. They do need access to services to improve their health and some support. But overall, they're fairly low risk. A moderate risk level patient, they've been diagnosed with cardiovascular disease, maybe COPD, maybe diabetes. They have mild signs of these issues. Maybe things are starting to affect their lifestyle a little bit. Maybe they can't go for jogs. Maybe they can't do the same family activities they used to do. And they need encouragement to maintain a healthy lifestyle. They need to make sure that they have structured care management to ensure that they are compliant with medications, doctor's appointments, and diet. Our high risk level patients, these are patients that have a medical history of a heart attack. They may have COPD that requires oxygen, or maybe they need 2 to 3 inhalers for their COPD. They have vascular disease that's required surgery, and they may even be undergoing something like a cancer treatment. They need multiple treatments. They need rigorous lifestyle interventions. And they also need education on medications, compliance, adhering, diet, all of the above. Our chronic risk level, these patients typically will have multiple comorbidities. So they have at least 3 or more cardiovascular disease, COPD, diabetes, high blood pressure, whatever it might be. They have a pretty heavy family history of these things. They need critical lifestyle changes. They need integrated care. And oftentimes we find that patients that have lived with a chronic disease for a while do have some sort of mental health or anxiety, depression from these issues because it has affected their life so much. So one of the main questions is, well, what do I need to get started? The answer to that is very little. You need a chair. A lot of our exercises, as you'll see, I'll go through a few of those, are actually based from a chair. You are welcome to get a yoga mat if you would like and feel like you're able to get on the floor. Maybe some light weights, hand weights, if you're able to do that. If not, we're pretty crafty at using things around the house for weights. Comfortable clothes. As Tim mentioned earlier, we do provide heart rate monitors, blood pressure machines, scales, whatever equipment you might need to make sure that you can monitor the appropriate vital signs. We would get you that. And our RecoveryPlus patient app, it's a very seamless user experience. So by that, your exercise physiologist would prescribe you exercises. You would wear your heart rate monitor, check your blood pressure through these exercises, and it's customized for you specifically. You do have of course, you have team members that are available for you if you have questions. Your progress is tracked through the app, and then that progress can also be shared with your doctors. And it has been submitted for FDA approval to be used as an actual medical device. So this is a kind of a sample of what we would have for treatment plans. So you could do easy, moderate, or advanced. You might see that you would get 30-second breaks versus 60-second breaks. And then you would have the amount of exercises for each and reps. They would increase, of course, the harder it gets, but you can do 15, 30, or 45 easy, and so forth with our advanced and moderate. This is a sample exercise here of something that would be considered easy. I'll play that for you here. This is seated, reach for the sky. So this would be for a patient that maybe was a very high fall risk, felt very unsteady, but we're still able to get your heart rate up with this. This is a little bit more advanced, same motion, but you're able to stand. And you add a few more motions in here. We can also add light hand weights to this to make it even more advanced. So RecoveryPlus and Mended Hearts work together to make high quality cardiac rehab easily accessible. We have informative sessions like these for each of the chapters of Mended Hearts. You can sign up at this link. We also have new clinical trials that are available for Mended Hearts members. This link here, the rplusrehabstudy.com. And then we also have our patient app, which you can get on Android and on Apple. And we are very excited for our Mended Hearts members to be kind of the first to test drive, so to speak. And we know the app is amazing, but we are always looking to get feedback. So with that, we do take a very holistic approach to the overall well-being of each patient. So we've talked a little about the movement, we've talked a little about the nutrition, but we also do mental health assessments and coaching along the way. If we find that intervention is needed more advanced, then we can point you in the right direction and get you those resources as well. And now I would like to open the floor here for any questions that you might have.
There are a couple of questions, Jenny, in the Q&A.
You want me to go ahead and read those out for you, Jenny?
Let me pop up here and see. Okay.
They're in the Q&A, Jenny. Can you see that?
Yes, I am reading here. I have a question about when I went to cardiac rehab in person, they were told that Medicare has a limit to 36 visits. And is this the same with remote? So that is a fantastic question, and it is absolutely not the same. So when you do in-person cardiac rehab, that is correct. There are limits to how many sessions you can go. It is 36. That is correct. With us, with RecoveryPlus, we do not have any limits to how many sessions you can have. So there is no time limit on this many sessions or this is how long. You actually can participate in cardiac rehab with remote with us, with RecoveryPlus, till end of life, or until patient volition, which means you decide you don't want to do it anymore, or if your doctor decides that it's not what is best for you. So absolutely, there is no limit on sessions. And the next question here is, what if you don't have a smartphone for the app? Can it work on a computer? The app itself, Peter, that is a great question. I have not ever tried it on the computer. Do you know if that works on the computer?
Yeah, no, the app does require a iPad or a smartphone, but the app is just one of the ways that we communicate with our patients. We can do that as we are communicating now over Zoom. There are a number of, or FaceTime if you prefer that. There are a number of ways that our exercise physiologists will communicate with our patients, some of whom don't have smartphones, some who don't have reliable internet connection. So we always find a way. Great question.
Absolutely, yes. And our next question here is, will the list of ways to sign up be posted? Yes, I will put the email in which you can contact us up on our next slide here. You can call us at that 800 number, or you can also email us at info@recoveryplus.health. So our next question is, how do I find a physiologist near me? So that's the great thing about what we do, is your physiologist doesn't need to be near you. We just need a time that you can do it, and that's what works. So we do everything virtually. So there's no need for anyone to be near you. You can actually be on vacation in Paris, France, if you would like, and you can still do your exercise. You don't have to miss any rehab days, if you so choose. So no need to have someone near you. Okay, next one is, does the email require n.org.com? Oh, no, it does not. Nope, it is info@recoveryplus.health. That is the correct email.
Yes, yes, it is recoveryplus.health. And then there are two questions that are kind of related about CPT codes and traditional cardiac rehab and the time frame. And those are related because to the question that Jenny answered earlier about the limits on cardiac rehab, we are considered a remote patient monitoring service, to use the term, and that's how we bill. And that's really the answer to the question why we're not limited, because we're not a traditional cardiac rehab program. We're classified somewhat differently, even though what we are delivering is cardiac rehabilitation. So it is a technicality, but it's an important one, and those are really good questions.
Yeah, and if I could actually kind of build upon with what you were saying, especially when it comes to the CPT codes, really what we do is when we go over the course of an entire month, because we'll bill Medicare and commercial insurances, about every, once every calendar month, just so that, just to keep it, nice, like I said, in the realm of insurance billing, we always try to make it as easy and as clean as possible. So really what we look at is depending on, what kind of services were offered and, how much time, was offered, who, kind of who you met with, we kind of go through each individual claim. This is kind of one of those pieces that I really try to help focus on, because that's, again, expertise and forte for me. But we basically look at every individual person. We look and see what services were performed, how much services were performed. So, typically there's about a list of about 12 different CPT codes that we potentially would use. But based on whatever, like I said, whatever kind of mix of services you had over the course of that month, then that's kind of what we'd bill out. So it's, I just want to make sure that I, answer that question is good as possible. And so, like I said, there's different sets and series of CPT codes. But I will say this, though, when we do, especially upfront in the enrollment, we will check with your insurance. Like I said, we're in network with, all the major insurances. But that is one of those things I personally don't like surprises. when it comes to, my health insurance and things like that. So it's always one of those, we offer that courtesy to everyone else. We'll talk with your insurance. So that's one of those things that, we do promise, there won't be any surprises or any surprise bills or, like I said, anything like that. We take what insurance gives us. We have contracts and credentialing with those insurance providers. And like I said, we, no surprise bills or anything would ever come from us.
Yes, and so this is a great question. Traditional cardiac rehab requires that your event be within a certain time frame in order for you to do their programs. And does that apply to remote cardiac rehab? It does not. So you can have had a cardiac event or even not had a cardiac event. You could have high blood pressure and high cholesterol, and you don't want to have a cardiac event. And you can still do remote cardiac rehab with RecoveryPlus. So there is no time frame. You could have been diagnosed with high blood pressure when you were 25 and maybe you're 55 now, and that is totally okay. And you can have had a heart attack 15 years ago and you can still do RecoveryPlus. That's a great question. You can also have had a heart attack 2 weeks ago and still do RecoveryPlus cardiac rehab.
Yep.
Okay, how is the routine that is best for you decided? So again, a great question. Everything we do is very individualized and custom. So once you have had your first initial conversation with your exercise physiologist and your testing, which is like a 6-minute walk test, they talk about limitations with you, what you feel like you can do and can't do safely. And they will then do an exercise prescription with you. And they come up with that created based off of your specific testing, your specific diagnoses, and any kind of feedback you've given them on what you feel like you can or cannot do. So it is very customized to you. And can the program be accessed via Zoom audio? So with that, Zoom video is important because we want to be able to see how you're doing the exercises, how you, if we need to modify. So if we're able to see you and you can see your exercise physiologist, then we can better determine if the exercises that were given to you are best for you. So Zoom audio, audio is not quite enough, but there are a lot of ways that we can get around that. So there's a lot of different options for that. If you have any kind of smart device or computer, typically we are able to do that. How can we get primary care physicians informed about this program? That is $1 million question.
Yeah, that is central to our goal of scaling access to cardiac rehab, where it really all comes down to that. How can we, and it's not a matter of 10% more people or 20% more people, it's multiples of people on cardiac rehab. It's estimated about 250,000 people are actively on cardiac rehab in the US. It should be at least 5 times that, even according to the very conservative Medicare numbers. So central to our marketing strategy is reaching out to the healthcare professionals. Obviously, we do a lot of work with cardiology practices and cardiologists. We are expanding to talk to senior centers, to primary care physicians. The study that Tim cited earlier in this presentation from Medscape, they specifically say as one of the issues in access to cardiac rehab is that PCPs are not aware that they can directly refer, which is absolutely true. Any practicing doctor can refer their patient to cardiac rehab. Doesn't have to be a specialist. So yes, to the heart of one of our marketing challenges, which will probably be ongoing forever, is continuing that educational process. Another pillar of that is this partnership with Mended Hearts, where we're able to talk directly to educated consumers who are actively involved in their own care, something that's not typically done by cardiac rehab programs. And we will continue to spread the word and to reach out more and more. So again, to scale access to cardiac rehab, through making it accessible and educating both healthcare professionals and patients and caregivers about its availability.
And if Peter, if I can also kind of build off of what you're saying, and it's even too with what Peter was saying, and I'd echo as well, is when you really look at, primary care or cardiology, but in this case with the question, primary care, the primary care physicians are typically get bombarded each week with, any type of drug sales reps or equipment sales reps. And, there's a lot of moving pieces that happen behind the closed door. So one of the things that we have found to make it very easy is the hard part is it's always trying to get at least, an audience with one of the physicians. And usually when you do, it's a tight window. We're talking, usually less than 30 seconds. And so what we found in the past is, for example, like when a cardiologist refers a patient, we can send reports to the cardiologist and the primary care. So in this case, what we encourage is the best way for primary care to see exactly what we do and is to, for example, let's say you sign up and then we have your vitals, we have this data, we have, you're exercising, here's how your body's responding. We actually create a very simple, easy to read document, like a picture of you. And when we send that to the physician, it's not someone, it's not like we're one of the 100th person that's come in that week trying to sell them something. It's like, no, here, this is actual tangible, like this is one of your patients. And then they see it. And then it's usually the question we get is, well, who are these people? This is actually kind of neat. Well, I need to know more about this. And that's kind of like Peter talked about as regarding the marketing efforts. It's always easier for us to have conversations with physicians when it involves a patient, as opposed to us trying to come in like a sales rep, and we get in that type of a line.
Mm-hmm. A question here, doctor, or it's a statement really, is that doctors don't know cardiac rehab is available for heart failure, not just heart attack or stents. And so to kind of piggyback on this, one of the requirements for heart failure patients and cardiac rehab in the traditional setting is that you actually have to, one, have an ejection fraction or a percentage of your heart functioning at 35% or less. And if you don't, you're told, sorry, you have to go get a little bit worse before you can do a cardiac rehab. We do not do that. If you have a heart failure diagnosis, then we want you to not get worse. And then the other part of that is if you have heart failure and you do have it bad enough, then you have to wait 6 weeks before you can actually start a program in a traditional sense. But with us, we also don't want that because we do not want readmissions. And if it happens in 30 days, then it would definitely happen in that 6 weeks that you were told previously you couldn't do anything. But we do not have that standard. Yes, we definitely want you to get started.
Excuse me, Jenny, can you hear me?
Yes.
Hi, it's Rick from Florida. Would you mind pulling up that chronic conditions and then maybe explaining to the attendees about the person only needing two chronic conditions to qualify for the program?
Yes, I can absolutely do that.
I do appreciate you. Thank you so much. It's a wonderful presentation. You always do such a great job.
Yeah, give me just 1 second to get that pulled up. One moment. Oops. Okay. Almost there. Oh, Okay, here we go. My computer is being a little bit slow here. Okay.
Do you want me to go on and see if there are any more questions in the chat box?
Yes, and I've almost got this. Oh, here we go. Okay, perfect. Yes, okay. So here is the list of, and this is of course just a few of them, of the diagnoses that would be acceptable for what we consider chronic conditions, and you only need 2 of these. So for example, arthritis is one. So you could have arthritis and you could have high blood pressure. You could have heart failure, and you could have chronic pain. You may have had a stroke in the past, and then also be a smoker. So any 2 of those, any 2 of these here listed, and then we also have an other here, because there's a lot of others that are considered chronic conditions. Acid reflux, that is a chronic condition. So any of those actually would qualify you under insurance parameters for Recovery Plus. And let me get out of this one. And whoops. And I believe slide 25, is that correct? Is that the one you wanted? I think I saw a question there.
Yes, someone asked to see slide 25 again.
Okay. There you go. Let me go back to the questions here. Okay, I think that I've covered all of those.
Jenny, I think that maybe they wanted the slide before that with the contact information. The email and phone number. Yeah.
This one
Can
here?
we, Steph, can you drop that into the chat just so people have access to it when when the slide goes off?
Perfect. And then, so what patient outcomes are you measuring? So yes, our patient outcomes are kind of what we originally talked about, which were we do the 6-minute walk test. That's on par with traditional cardiac rehabs. We also look at the SF-12, which is also a very common quality of life indicator that is used in traditional cardiac rehabs. We also look at the PHQ-9, which is a depression and anxiety questionnaire. We look, and a lot of it is based off of, we do look at vital signs. So we're watching to see improvement and stability. We're making sure that vital signs, heart rate, blood pressure, weight possibly is stable. We don't want to see a lot of fluctuation. So that's one of the things that we're looking at, as well as the, of course, SF-12 6-minute walk and the PHQ-9. We also base it on patient compliance. We look at compliance rates. We look at readmission
rates. Yeah.
Readmission rates. Yeah, we do a lot of data collection, probably more than I could even name off right off the top of my head. It's so many things that we look at. And to be very honest, there really aren't a whole lot of virtual programs. So we do compare with mostly traditional.
So it's a good question about the benchmarking. There have been some studies that have assessed virtual programs. And in fact, the link that was on the earlier slide to the R and is in the messages there, the R+ Rehab study. In fact, to that question and to Jenny's point that there are not any really head-to-head comparison studies. So we're doing one. We're in the process of recruiting patients for our first clinical research in the US. The first few patients, thanks to Mended Hearts, they're all Mended Hearts members so far, have been enrolled. They are supplied iPads with our app running on it, and we'll go through a program. So we'll be completing this research over the course of the summer and publishing it sometime in the fourth quarter of this year. Also worth mentioning at this point that the app that we've talked about and showed you some screenshots of is in the final stages of being approved by the FDA as a 513G medical device. So it will be an FDA approved app. I don't think they're going to ask us for any more data. It sounds like they've pretty much assured themselves that it's safe, which is of course their biggest concern, and obviously it is. And then and also effective, does something effective for the patient. So hope that answers your excellent and on point question. As this type of telehealth virtual program grows in popularity and for a wider range of conditions, we have our niche, and we have the condition that we are looking to scale access to. Of course, there are many others which we're all familiar with, particularly in the growth of the use of telehealth services during the pandemic, which pretty much mandated it. So we are very pleased to be launching a study that does addresses exactly your question, which is a head-to-head clinical comparison. There's a good question about the 6-minute walk test there, Jenny, which
yes, and I did. I answered that one. Essentially, our exercise physiologists have tools that they use to determine the length that they are walking, time, and then they use a calculation to determine how many meters that is. Strength and balance, similar, and everything we do is monitored via video. Therefore, we can monitor if it is being done appropriately. So that way we can get the best results.
Excellent. So we know that there is a training program that Mandy is overseeing that starts at 4. I want to make sure we don't start overlapping and give everyone a chance to pivot from one meeting to another. So if there are any last questions, please share them. If not, we are going to say thank you very much for your time. Mandy, do you want to make any concluding remarks? Because I think we have. Thank you, Jenny and Tim, for taking everyone through the program, and thank you for lots of really insightful, penetrating questions that get right to the heart of the matter here. Pardon the pun, Mandy.
Yeah, I just want to thank you three. That was an excellent presentation, and this is such an important topic. So we appreciate any information that can help our members be healthier, be heart healthy. Thank you.
Happy to do this presentation for the individual member groups. We've already done a few, and our goal is, I know there are hundreds of them, so our goal is to cover all of them, and it might take a little while, but we'll get there. So please reach out. Happy to schedule follow-up meetings like this for your local groups.
Perfect. Yes, and if anyone needs information, all of that's in the chat right now. And if you can't capture that, you can always email me and I'll connect you with the group.
Yep.
All right.
RecoveryPlus.health is the website, and if you're interested in the research, it's that r+rehabstudy.com to find out more about that, or email us. We will get back to every email or phone call. And thanks for coming. Great to see such a turnout. Mandy, really appreciate you and Al coordinating and making this happen. And we'll talk to you very soon.
Sure.
Thank you, Mandy. Mandy will be in touch if we need anything. Thank you so much.
Thank you, everyone.
Thanks, everybody.
Have a great day.
Y'all too.
Bye-bye.
Bye now.
Bye.